Well, prostate cancer is seen after a certain age. So when a gentleman reaches 60 or above 60, we have a suspicion of cancer of prostate depending upon his symptoms and physical examination, and also family history. So if the urologist finds that this is important for you to undergo certain tests on the basis of your family history or on the basis of your symptoms or physical examination. So if your urologist finds some abnormality in your physical examination or in your symptoms or family history, then probably he will go for certain tests. The most commonly and the first tests which are needed as the first investigation in the diagnosis of prostate cancer are: number one, a blood test called PSA, prostate specific antigen. Now this blood test is specific for prostate gland. So if you have a high serum PSA, that means that there is or there might be some disease in your prostate. It doesn't necessarily mean you have a cancer. So high PSA can be there because of some infection in your urine, infection in your prostate, some trauma, retention of urine, or a cancer of prostate. So first thing is a serum PSA test, not on single reading. We have to repeat it, preferably from the same lab. Single reading of high PSA doesn't mean anything. Now the second thing is the finger examination of your prostate. The urologist will examine your prostate with his finger, and a prostate gland which has a cancer inside it has a certain hardness in its texture and in its feel. So these two tests will raise suspicion of cancer in the prostate. Depending on the findings, suppose if the PSA is high or if the finger examination is abnormal, then the patient will need further investigation. The only test which can confirm or reject the diagnosis of prostate cancer is a biopsy. So biopsy means taking out small amount of tissue through a needle under ultrasound guidance from your prostate. So here a small piece of prostate is taken out with the help of a needle under the ultrasound guidance, and this piece goes for a pathological examination. The pathologist will see under the microscope, and then he will tell us what kind of disease is lying inside the prostate. If it is a cancer or if it is not a cancer. If unfortunately it is a cancer, what kind of cancer is that? What is the grade of cancer? How aggressive is that? So this helps us in confirming the diagnosis and also in planning the treatment. Now, sometimes the patients, they present in a borderline situation. So what I mean, the PSA is slightly raised, the finger test is normal, or sometimes the finger test is abnormal but the PSA is not raised, and in many other situations the urologist might find it useful to go for an MRI of the prostate. This MRI gives us a picture of the prostate both from the outside and the inside. So it will help us in understanding what is going on inside the gland. If there is any disease, if there is any cancer in the prostate, how far it has gone outside the prostate. So it helps us in diagnosing and staging the spread of the prostate cancer. So blood test, serum PSA, finger test, MRI and biopsy. These are the 4 tests. They are usually done step by step to reach to a diagnosis. In today's age, the cancer of prostate is curable. It is completely curable, and the diseased gland can be taken out of your body and the disease can become a history for you. Now, the treatment of this prostate cancer depends upon the aggressiveness. What is the risk category? There are other treatment options also available, and sometimes the patients have got choices. Depending upon what is the aggressiveness of the cancer, the patient and the urologist, they sit together and then they discuss what are the options available for him. If the patient is fit for a surgical procedure, this cancerous prostate gland can be removed out of your body with the help of a robotic technique, which is called a robotic radical prostatectomy, or through a small incision in the lower tummy, which is called open radical prostatectomy. So robotic radical prostatectomy and open radical prostatectomy are the two procedures in which the prostate is removed and the urinary system is stitched back together. This can cure the patient depending upon the stage of the disease, specifically if the patient has approached the doctor timely before the disease has spread outside the prostate. For many patients, there will be other options available like radiation therapy, hormonal therapy, chemotherapy. All of these modalities have got certain pros and cons, some plus points and minus points which needs to be discussed in details. Radiation therapy might need multiple sittings. There are certain side effects of radiation therapy. Hormonal therapy or chemotherapy is usually given when the patient is not fit for surgery or radiation, or if the disease has progressed widely. The surgical treatment for the cancer of prostate has now become very simplified. The hospital stay is roughly around 2 to 3 days. With the help of robotic technique, the post-operative and the perioperative pain is very less. There are very small scars and the recovery is very fast. Now, if the disease falls in the category of low risk, which means that the threat to life is very low, the patient has got options of observing, just keeping the disease under observation, which is called active surveillance. Or in case if the patient is very old in age, is not fit for any procedure, then also we can just keep an eye on this disease, which can be done with repeated serum, PSA, finger tests, MRIs and sometimes biopsies. So if the disease is low risk, it is usually considered indolent disease, that means not a threat to life, and many times it is safe to just keep it under observation. But specifically if the patient is not very old in age, is young, and the disease is not very low risk, it falls in the mid category, then it is best to remove the disease out of the body. With the latest techniques, the surgery has become very less painful. The recovery is very fast. The patients can come back to their normal life within a few days, and the patients can resume their normal work and duties very soon after the operation. So in nutshell, if you have any symptoms related to your urinary system, if you have ever noticed any blood in your urine, you must consult a urologist, get yourself checked for your blood test or for a finger examination of your prostate, especially if you are above 60 years of age. In those gentlemen who are not above 60 but they have a strong family history of prostate cancer, they also need to be examined and sometimes screened for serum PSA and rectal examination at an early age. So it is always advisable to meet a urologist and get yourself checked. Thank you.